Hello, everyone. We'll just be starting in 2 minutes' time. We are waiting for our co-organizers to join and for the other attendees as well. I welcome you all and let us begin with a video. Hello, Gareth.
Oh, hello, nice to see you.
Great to be here. We will just start with a little introduction video, and then we will start with the presentation with the intro as per the timeline that has been shared with the co-organizers. So let us begin with the video, please.
Welcome to the AFIHS Global SDG Panel Discussion 2020. Global knowledge, innovation, and partnerships come together for sustainable. Welcome to the AFIHS Global SDG Panel Discussion 2025. Global knowledge, innovation, and partnerships come together for sustainable change. Today, we focus on 3 vital goals: SDG 3, good health and well-being; SDG 4, quality education; and SDG 17, partnerships for the goals. Today, we focus on 3 vital goals: SDG 3, good health and well-being; SDG 4, quality education; and SDG 17, partnerships for the goals. SDG 3 ensures healthy lives and well-being for all, addressing health equity, disease prevention, and mental health. SDG 4 promotes inclusive, quality education and lifelong learning opportunities for children, youth, and adults. SDG 17 strengthens global partnerships, enabling knowledge, resource, and expertise sharing to achieve sustainable impact. This panel discussion brings together global experts to share insights, collaborate, and drive innovation. It creates a knowledge-sharing network that empowers communities, strengthens partnerships, and inspires action toward achieving health, education, and sustainable development goals worldwide. Join us as we connect, learn, and take action together. AFIHS Global SDG Panel Discussion 2025, where knowledge meets action and partnerships drive global impact.
So that was an initial video that would create an interest in the audience. And now we would be beginning with our first presentation. So welcome to the panelists and welcome to the audience to AFIHS Global SDG Panel.
That's you. Cannot hear you. We're not hearing you.
Oh, sorry, now can you hear me now?
Yes.
Yeah.
Okay, sorry. So about AFIHS Global SDG Panel about the event, step into a transformative dialogue where global thought leaders, educators, innovators, and change makers unite to explore actionable strategies for achieving the United Nations Sustainable Development Goals. Ranked among the top 5 most globally credentialed and connected health science institutes, AFIHS proudly presents this flagship event to foster collaboration, share insights, and inspire impact. The objective is highlight critical challenges and opportunities in education, health, and partnership, promote knowledge sharing and cross-culture collaboration, empower participants to drive sustainability change globally, and the tagline is innovating today for a sustainable tomorrow. Now we would like to welcome wholeheartedly our esteemed panelist, Professor Sherman Roberts, Dr. Tomislav Meštrović, Ms. Jennifer Johnson, Professor Robert Aphang, Mr. Gareth Durant, and Ms. Boson Lily Liu. Now I would like to start with something about Al-Fateh Institute of Health Sciences. We are a global leader in health science education, ranked among top 5 most globally credentialed and connected health science institutions in the world, with diverse academic excellence, global partnerships, recognized expertise, and a commitment to the SDGs. The recognizing the challenge. Fact: over 60% of Pakistan's population is under 30. Fact: over 10% of youth have access to skill-based education and vocational training. Fact: youth unemployment rate is approximately 8.5%, higher than the national average of 5.8%. Fact: addressing the skill gap could add up to $30 billion annually by 2030. And fact: only 5% of youth are engaged in entrepreneurial activities. Solving the challenge. Our solution is comprehensive, high-quality education, and the key features include accredited program along with others. International and national partnerships that we have, there are strong partnerships, industry-aligned collaborations, enhanced learning opportunities, global perspective, networking advantage. Our core team is Mr. Khalid Pervez is our CEO, Mr. Umar Chatta is our Managing Director, and I am Mohammad Umaid, I'm the Marketing Director. Our building, where it has cutting-edge infrastructure, it has additional amenities, it has student spaces, and it is focused on excellence. The student activities include their vibrant community hubs, club events, competition, and other activities. A bit about myself. I'm Mohammad Umaid. I'm the moderator. I'm an educational entrepreneur, a lifelong learner, and a global voice in digital learning. I'm the world's most diversified digital credential holder. I have double master's degree, MA in marketing and innovation, and MBA from Anglia Ruskin University. And I'm the director at Al-Fateh. I'm at the advisory board of Federation International of Pharmacy, Harvard Business Review, and I'm recognized in LinkedIn as a top voice, and my passion is advocating for lifelong learning, innovation and education, and digital transformation. Thank you very much. Here's about an SDG that we will start the video.
Everyone dreams of a better life
For themselves,
for their families, and for the world.
But what does it really take to build a future that's healthy, educated, and sustainable? Let's start with something we all need, good health. SDG 3, good health and well-being, reminds me that access to quality healthcare isn't a privilege, it's a right. I've seen how health literacy can transform entire communities, helping people prevent and manage illnesses before they become emergencies. And thanks to technology, knowledge spreads faster than ever. A nurse in India can now learn best practices from a doctor in Brazil instantly. That's powerful. But it doesn't stop there. SDG 4, quality education, shows me that education is the foundation for everything. It's not just about sitting in a classroom. It's about opening doors, sparking curiosity, creating opportunities for everyone at every age. Digital platforms now reach people in the most remote places, making lifelong learning possible. And when education is inclusive, no one's left behind. Imagine a world where every child, no matter where they're born, learns to read, write, and dream big. How do we turn these dreams into reality? SDG 17, Partnerships for the Goals, is the answer. I believe global challenges need global solutions. When governments, organizations, and individuals join forces, they share knowledge, resources, and creative ideas. That's how we accelerate real progress. Whether it's a community clinic teaming up with local schools or entire nations working together to fight disease, partnerships make us stronger. So, what can you do? Start by learning about health initiatives in your own community. Start by learning about education initiatives in your own community. Support organizations that empower others. Connect, collaborate, and
Now, a video about Al-Fateh Institute, and then we will start with our panelist. I think so it's a bit here. I'll share it with the participants as well. So now it's time to move with the first session. I hope the audience enjoyed the videos, the panelists liked it too. So now, with all due respect, I would like to introduce our first participant, our first panelist. I am a big fan of him, and he is a great source of knowledge and inspiration. Ladies and gentlemen, please welcome Dr. Sherman Roberts for his keynote address. Dr. Sherman Roberts, please.
Hello. I guess it's over to me. I very much appreciate the opportunity to be here. After seeing your opening presentation, I realize I'm in the right place. I'm with like-minded people, and I am very, very grateful for this opportunity to address you. I guess I need to share my screen here, and I've never used
I can do it for you.
Can you do that?
Yeah,
well, let's see. I can, it says share screen here, and I'm going to say allow, and I don't know what you can do on top of that, but let's by all means do it.
Yeah, please.
And I want to share a particular screen here, which is my PowerPoint.
Yeah, we have shared it. Can you see it?
Let's see. I can see it right now from my own point of view. And the question is, can you all see it?
Yes.
Excellent. So good. So without further ado, as rumored, I am Sherman D. Roberts, president of Blackwell Global University and distinguished professor of negotiation at Blackwell Global University. And you can see our logo in the center of this. Our mission is a very ambitious one. It is to democratize high quality post-secondary education worldwide. Now, we can't obviously do that by ourselves. So what we're trying to do is achieve partnerships in every country in the world and have students and also have professors in every country in the world. And we're doing quite well to date. We've got quite a few countries where we're present in the Western Hemisphere, and we have a few European countries lined up. I recently discussed, and it seems like we're going to sign an agreement with organizations in Uzbekistan, your fairly close neighbor there in Pakistan. And so we'll be in the neighborhood, and we hope to be in Pakistan before too long. What we're looking for is students and professors, but we do this by finding an educational entrepreneur in each country who will be our Blackwell country liaison. We realize that we can't deal with the culture in the same intimate way that someone from the country can. So we look for someone to represent us to the country and the students and the country to us. So that's what we mean by liaison. So I was told that I have to tell you a bit more about who I am and about my personal journey. And I'm going to start where the red dot is. Can any of you tell me what U.S. state this is? This is a map of one of the U.S. states. Which one is it? Just shout it out.
It's in Texas. This is Texas, the state is.
All right, that's the easy part. Now, what city is where the red dot is? What city is marked by the red dot?
That's a tough one.
It is virtually impossible. I'm going to tell you what it is. It's not really a city. It's a small town called Calvert.
Oh.
And Calvert, during the years that I lived there, which is about 20-something years, had a population of exactly 1,072 people. And it never changed over those 20 years. And there were several censuses during that period. And the city limit sign always said the same numbers, which meant that if someone was born, they had to kill somebody, I suppose, or something like that, because it stayed the same. And Calvert pretty much has stayed the same ever since, and pretty much before that. Now, I grew up in this small Texas town, but I had the advantage that I had books available to me, thanks to an uncle who had been somewhat of a distinguished academic and a politician, and he left me out-of-date encyclopedia-like books on technology and science and history, and including ancient history. And so I developed a view very early on through this reading that a lot of very important things were happening in the world. And at the same time, I realized that they weren't happening in Calvert, Texas. Calvert, Texas is mostly thorn bushes, post oaks, a little bit of cotton, a little bit of cattle, and not much else. The highway that runs from Dallas to Houston, Calvert is about at the midpoint of that. But not much happens in Calvert. So I wanted to get out of Calvert as soon as possible. So my life story is about getting out of Calvert, in a manner of speaking. One of the things that motivated me was that when I was 7 years old, my father was murdered because he refused to sell stolen and diseased cattle through his auction company. And so they tried to intimidate him. And when that didn't work, they killed him and took up negotiations with his successor in the company. So that was pretty traumatic for me. And I decided that I wanted to change things. So that gave me even more of an impetus to get out. Nothing much else changed that we need to know about until my last year at Texas A&M University, which was the only university that my family could afford. It's a good university, but it's not Harvard, and it's not Oxford, and it's not Yale even. So it was my stepping stone nonetheless. I graduated, and in my last year there, I was also kind of with one foot on the boat to go to Vietnam, because in addition to getting a bachelor's degree, I was getting a degree in the sense of becoming a commissioned officer in the U.S. Army. So I was going to, after graduating, I was supposedly going to Vietnam. So I met a professor there who'd been a transportation corps officer in Vietnam, and he convinced me to analyze the war just like it was any other research project. I was in political science at the time, so that came pretty naturally to me. I did investigate the war, and I did see that it was an exercise in U.S. imperialism, pardon the expression, but and it was a rather disgusting number of things that I discovered about the war and how it's being pursued. And I realized that it wasn't going to be won by any country, and both countries, or all countries involved, were in essence going to lose something very important, which was their people. So I decided to leave the U.S. Army. And so my next step was figuring out where I was going to go to reconfigure my life, because everything that I had done up to that point had pushed me toward a military career. So I didn't do that. I went to Venezuela with the help of a lovely family, the Alvarez family, and they helped me get started at the Catholic University there at a research center. And that's where I initially met a guest speaker there who was B.F. Skinner, and that was going to be important later. And then I did my doctoral degree at the Universidad Simón Bolívar in Caracas in psychology, because I had transitioned from political science to psychology. And I did it on learning. From there, I got an invitation to come to the United States around 1987 and be the deputy director of the Cambridge Center for Behavioral Studies. And there I was able to cultivate my friendship with B.F. Skinner, who had actually helped me in finishing my thesis, my dissertation for my degree from the Simón Bolívar. And that led to other things, such as my recruiting a lot of talent from Harvard to do executive education at this research center. And we did a whole series on leadership. And that led to my being recruited by the Harvard Kennedy School with the help of another illustrious contact, Richard Zeckhauser, and also Dutch Leonard at the Kennedy School. And so from 1996 to 2003, I led an executive leadership curriculum that produced 52% of the attendances at the Harvard Kennedy School. And as a result of that, I was recruited by Oxford University, the Said Business School, to create the Oxford program on negotiation. And I did that for 13 years. And that, in my view, I don't know exactly why I was contacted by one of the founders of of Blackwell, but that led to me becoming the founding president of Blackwell Global University. So that's the story of my life, my 78-year-old life. So it is kind of condensed, but that's kind of the best I can do for a short-term view. And this trajectory from that tiny little red spot in Texas to where I am now, having gone through what I've gone through, very much affects how I see the world today and how I see higher education. So I found out yesterday I'm supposed to deal not only with quality education, but the past, present, and future of quality education in 15 minutes. This is going to be tough. In the past, when we talked about quality education, we meant that the person who graduated could speak a few phrases or write a few phrases in Latin or Greek, knew some math, was well-rounded, whatever that means, and had mastered a discipline or a profession to academic standards. And I think we all know that those standards include institutional prestige and having standards in the first place, academic rigor, excellence with regard to the student's experience, accreditation and validation. We've got to prove that we're doing the right thing. Mission-driven effectiveness. We have goals and we need to set them and achieve them. Internal quality systems are de rigueur. And there has always been, even today, I would argue, a focus on the elite. And that concept of the elite has changed over time. It's more democratic these days, even in traditional institutions. And yet, 100 years ago, it was almost the elite was the rich people who could go to Harvard, Yale, Oxford, or wherever. And that was the elite that we were talking about. It is still so today, but it is less so, thankfully. So that's what it's meant in the past, and what I think it means, what quality education means these days is leveraging technology, particularly the internet and all of the things that we can do to make the experience of the student easier to access regardless of where they are. Wherever the internet penetrates, we can teach, which is great, and which is one of the things that Blackwell is trying to do. Now, progressing very quickly to the future, I'm laughing at this because I'm saying a lot of things that I know that there are plenty of experts on that might question some of this, and that's one of the reasons I hope that those who are listening to this will provide me with some feedback. So what I'm saying is that in addition to all of those quality standards that we've talking about before, what quality education now must mean is helping students to become true heroes. And I'm not kidding, and I'm not talking about, the Achilles or the Herodotus or the other military or political heroes of the past that just, were very forceful. I'm talking about people who are both effective in the way that humanity needs it and also ethical. The hero is always the good guy. He's not just a powerful person, not just a great warrior or whatever. The hero is always the good guy, and we need to know what a good guy is in our current world. We need to teach ethics as much as effectiveness. Because both are going to determine our results. If we behave ethically, we're more likely to get better results in the long term. So, why do we need lots of heroes now? I believe that it's because humanity as a whole, every mother's son, is facing unprecedented threats to survival. As if chemical, biological, and radiological weapons were not enough, we are facing a future threat from what I call real AI, which is not the simple data crunching AI that we currently have. That's just fine, and we have it. All of us have ChatGPT on our iPhones or our mobile devices, and that intelligence is not intelligent in the sense that a human being is intelligent. It just crunches data and spits out a response. Real AI is what I call live wired, or what better said, David Eagleman, noted neuroscientist, calls live wired AI, sentient AI. AI that not only has intelligence, the ability to crunch data, but also motivations, potentially emotions, and can make its own plans. What Eagleman means by live wired is that the human brain is not a computer. It's not a fixed piece of hardware in which you introduce software programs. A human brain rewires itself if a particular kind of sensory input isn't available. Other sensory inputs essentially take over and rewire that part of the brain, and we can use that to allow sight, the visual cortex, to understand tactile stimulation and interpret that as vision. That's an example of what David Eagleman calls live wired systems. Now, when we make such a live wired system, we will have created our successor, if that's what we want. And I allege that humans have never met a powerful technology that they didn't like. Somebody is going to do this because it's going to be possible, and they're going to try to use it to their own advantage. And they may try to exclude everybody else from it. So they may try to enslave this real AI for their own purposes. Or we have the scenario which a lot of people are worried about, which is that AI may develop its own, Spartacus-like rebellion and decide that we're too dangerous to have around. Either way, we're going to have two choices as humanity, as brown people, people of a bronzish color, white people, black people, all people. We're going to have to either unite with it at the most fundamental level, that is, become AI cyborgs, all of us, or we're going to allow it to make us obsolete, impotent, and effectively extinct as a species that runs the world. And that, to me, is terrifying in quite a number. It's disgusting in quite a number of senses, and it's also terrifying in a number of senses, because it is a real threat, and we are certainly capable already of killing ourselves in a variety of ways using the weapon systems that I mentioned. So we have to create an ethically better student in higher education, because that's when a person really, really becomes an adult and a contributor to society. And they have to be effective in getting the results that will allow humanity to continue to exist as the major player in human history. And that is going to be the real challenge. So I wanted to put that idea out to you. We can't afford just to have competent technicians and people who make espresso at the local Starbucks, or who do jobs of accounting, or do this or that. We have to create people who are more entrepreneurial. We have to create people who have in their vision the fate of humanity. And that's going to be difficult, because in the past, most heroes that are written about emerge because of their immediate family cultivating them to an extent, or the gods, or this or that, intervening to make them special. we've got to be able to do this on a post-industrial scale. We have to find ways to introduce ethics into our curricula, not as an afterthought, but rather as a mainstream, main focus, in addition to teaching whatever effective practices we may want to convey. So, in talking about this, I'm going to encourage all of you to read a book, if you haven't read it already, called The Heroes. Actually, it's called The Hero with 1,000 Faces, but it describes what's called the hero's journey. And I encourage you to think of your students, although they may look ordinary to you, as potential heroes, and try to cultivate the hero, the ethical, effective person, to the maximum in that particular individual. So that's the end of my sermon. Thank you for your kind attention.
Thank you very much, Dr. Sherman. That was really inspiring. That was really encouraging for all of us. And now I would like to move forward with our next speaker, our next panelist, Dr. Tomislav Meštrović. He is the global coordinator for HIFA, and he is representing SDG 3 Global Health. So over to you, Dr. Tomislav, please.
Okay, thank you very much. It's an honor to be in this among these really amazing experts. And it was a really inspiring story from Professor Roberts. Just a confirmation, can everybody see my screen?
Yes, we can.
Okay. So I will also follow the similar path. I will shortly introduce myself and then give some broad overviews why I think SDG, especially SDG 3, linked to health and well-being, is very important. So it's interesting that Professor Roberts mentioned the war. I'm also a child of war. So in former Yugoslavia, we had a Croatian War of Independence. So I was 7 years of age at the time when the biggest war strikes were occurring in Croatia at the moment. But so all of these things that are happening in the world are basically evoking those memories. But regarding my professional path, I finished my MD degree and my PhD degree at the University of Zagreb School of Medicine. I specialized in clinical microbiology. But slowly, I was more and more interested in first in public health, then in global health. So I pursued my master in public health degree at the London School of Hygiene and Tropical Medicine. And all of that led to becoming a Fulbright alumnus of the University of Washington School of Medicine, more specifically Institute for Health Metrics and Evaluation in Seattle, where I got involved in the global burden of disease projects, especially in the global burden of antimicrobial resistance and infections. And currently I'm also having a dual affiliation. I'm associate professor at University North in Croatia, and I'm affiliate associate professor at University of Washington School of Medicine in Seattle, and also I have some visiting professorship posts. In Croatia, University North is one of the leading universities, especially in terms of SDGs, or Sustainable Development Goals. Recently, there was a Times Higher Education list where we placed really high based on these factors. And there I became a director and founder of a Health Metrics Center, where I try to link some national efforts in estimating the burden of disease with the global efforts that I do at the University of Washington School of Medicine, and try to support evidence-based public health decisions with that work. I still work heavily with IHME and UW. We do a lot of burden of disease studies linked to infection because, of course, this is my primary area of interest. But also, in doing that, we saw a lot of data gaps and a lot of places to improve data gathering efforts. I done also some advocacy and governance work, and today I'm also here as a representative of Health Information for All campaign. I will talk a little bit about it just in a minute. With them, and especially with Dr. Neil Peckham-Walsh, who is also in the audience, we developed some policy briefs led by World Health Organization about the quality of care, quality of health services, especially aimed at universal healthcare implementation. I was also leading some AMR policy briefs for G7 meeting in 2022. Currently, I'm a member of AMR expert group of the World Health Organization and also an infodemic manager of World Health Organization. And in HIFA, I'm a global coordinator for country representatives and country representative for Croatia. This is also how Mohammad invited me. He's also a country rep for Pakistan.
Yes.
HIFA, or Healthcare Information for All, is a very big campaign. It has more than 20,000 members. And it's aimed towards accessible healthcare information and health literacy. And this is something that also World Health Organization recognized. And now HIFA is in official relations with the WHO as well, advocating for digital equity and also open access medical knowledge. And also I would like to emphasize HIFA has more than 400 supporting organizations. Among them are World Medical Association, for example, International Federation of Library Associations, my University North. And the goal is not only to generate evidence, but also to see how to find it, how to apply it, and how to disseminate it widely. And the overall aim is, of course, striving towards a world where every person and every health worker has access to the information they need to protect their own health, but also the health of the others. And in that regard, I also lead some other initiatives, for example, with the biggest European Society on Infections, European Society for Clinical Microbiology and Infectious Diseases. We organize antibiotic awareness weeks for 2 years in a row. I'm their main representative in organization of this event. Cervical cancer is still high in the world, so it's important to organize international HPV days around the globe. I organize it for Croatia, and also European Union is increasingly recognizing One Health as a salient approach, because health should not be looked only from the human perspective, but also from the animal and the environment. So this is something where I contribute for the European Commission also to develop some concrete guidelines how to approach this issue in the future. And all of this, of course, links to SDG 3 for health and well-being, which aims to ensure that for every person on the planet and for every and for person of every age on this planet, covering maternal and child health, communicable and non-communicable diseases, and of course, universal health coverage. But as we will see today, and also probably during the discussion later in the panels, it intersects with other SDGs, and these links are really, really close to, for example, SDG on education, on climate, on inequality, etc. And this is important because we know health is a prerequisite for social stability, but also for economic growth and equity. We need it for human capital development. We need it for productivity. And this is something that should be viewed as a global common good, and why we should strive for these key parameters to achieve, such as equality, equity, and of course, universal healthcare. So my focus in doing that, I also organize at my university SDG weeks, SDG days. They intersect with the work that I do, but I also try to have a broad perspective from equity lens, also digital health transformation and open science. And in the future, of course, we will need better gains in life expectancy in maternal and child health. When you look at these goals, they're always posited so optimistically. Some say they're overambitious, but I think they need to be overambitious to achieve anything, because we still see a lot of inequalities between and within countries. And during my global burden of infectious disease studies, you can still see a lot of inequality in the world regarding the infectious disease and antimicrobial resistance, which is now being compounded and worsened by climate-related health risks. So this is something that will need even more discussions in the future. And of course, it's recognized by all the main bodies in the world. So this is why science, especially science linked to SDG 3, has to be accessible, has to be collaborative, and this is something that we are doing today, has to be people-centered, especially regarding messaging, and has to bridge between evidence, governance, and practice, and this is something that has been lacking in the recent years. And as we heard in the previous presentation by Professor, we need open dialogue, we need adequate mentorship, we need to equip people to be aware of these issues and to be more community-driven in order to solve some of the most pertinent things that we need to solve in SDG 3. So this is, in a way, my presentation I would like it to serve not only to present myself, but also as a way, as a call to action, as something where to put the emphasis to support interdisciplinary education, research translation, to empower local health innovation, and also health metrics capacity. And this is something I try to do locally, but also expand on a much higher scale. And of course, promoting equity and advancing these goals, these key indicators through collaboration and action. So thank you so much for your attention, and I hope we will have more opportunities to discuss these issues now, later, and I'm always available for you to contact me whenever you have a chance. So thank you once again.
Thank you, Dr. Tomislav. That was an excellent introduction. And now I would like to warmly welcome Ms. Jennifer Johnson. She is the Director, International Relations at Columbia Southern University, and she is representing SDG 17. So over to you, Ms. Jennifer Johnson, please.
Good morning from Alabama. Good evening to those of us that are in different time zones. It is my honor to be here today to share a little bit about myself in Columbia Southern University, and then as well speak more to SDG 17. So I'm going to share my screen. This is a little bit about me. This is my bio. I spent 26 years in the United States Air Force. I joined the Air Force at 17 years old in 1994. As most of us will recognize, we were in a place of war at the time. So the very first thing I did was go overseas and support all national interests. In that opportunity, over 26 years, working with all of our global partners in the military, and as well as serving as a capacity builder through that opportunity, teaching military skills, teaching life-saving skills, teaching how we can be cross-cultural across the world, across the globe. That is very, very, very important to me in my experience, in what I've learned through that opportunity. From there, in retirement, I was honorably asked to become the Director of International Relations for Columbia Southern University. What we've done since I've joined the team is we've begun a strategy for student recruitment, which is just about done and will be presented and posted or linked out live on our website for all. Our biggest, or most, I should say, most important philosophy is global learning and lifelong connections. That is our mission and our vision. So next I want to share just two information pieces about our university. We are fully online university. We have over 100 programs from the bachelor's, the associate's level, all the way through the doctoral programs. We additionally have continuing education. Our main focus is on adult learning, although we do have a good number of students that come to us as associates students in the younger ages, about 32%. And then we also have individuals that come to us for their continuing education to develop themselves in leadership positions, in growth positions and opportunities. You'll see on this slide on the left, those degree programs. We are most known for our fire science, our environmental management, emergency management, emergency medical services, occupational health and safety. Most recently, we've added a nursing program, and this program has grown widely this year to the benefit of our students and to the benefit of the globe. I agree with the first presentation or video that Mohammad shared, and it spoke to not just sitting in the classroom. Because our organization, our university, is fully online, Our students can join their class 24 hours a day, 7 days a week. This is most important for the working professionals that are trying to advance themselves, their organization, and their connections. We are SAC-COC accredited in the United States, which also applies in the global environment as we connect with international partners to help advance their goals. This specifically, our mission and vision speaks to SDG 17 because of capacity building, specifically 17.9, and then systemic issues, which is 17.13 through 17.19. I will share a little bit more about that in our next portion where we speak to the circle of life in our discussion. But for me, the key thoughts in leadership insights, my key thoughts as a personal and a professional, and as a director of international relations, is to make sure that we are doing the best that we can for our students. And that applies here to this discussion as the public health, as the global connection, as the global connection, and then making sure that we're sustainable. We, the world, not just the United States, are sustainable. Global learning and lifelong connections are imperative for all universities and all organizations across the globe. On the right-hand side, you will see our contact card. This QR, which I'll share with Mohammad, and he's able to send these out with the slides. This contact card will take you to a place of information requests, and they come directly to me. And I'll follow up with any questions you have specific to our university, specific to our initiatives. And again, I'll speak more to that in our next piece of our panel discussion. I appreciate the time and opportunity to be here, and I look forward to what we share and the questions that are coming ahead. Thank you.
Thank you, Ms. Jennifer. That was a great intro. And now I would like to introduce Mr. Gareth Durant. He's from NextGen U. He's an educationist. He's an health science expert. So I warmly welcome Mr. Gareth Durant, and over to you, sir.
Sure. Can everyone see my slides?
Yes, sure.
Great. Just a quick check-in on time. What's helpful now? Do you want to give me a quick understanding of what's a benchmark? I want to make sure I'm not talking over.
I'm saying 10 minutes. Yep. 10 minutes. Yep. You can take.
I'll keep it under 10.
Sure.
Yeah, I'm really enjoying the conversation today. I'll try and bring a through line to the work we're doing at NextGen U and Public Health U, but also to, I guess, echo democratization of education is so important. Having things like global burden of disease, the actual data available to everyone is also super important. Supporting students and people to do lifelong learning and connect globally is also important. And then hopefully the work we're doing fits really into that motif that we've started today. So I'll focus on a little bit about me, but really just jump into what does kind of increased access to education look like, particularly in the public health realm. My background is in public health. I was in Pakistan a couple of years ago working on polio projects with WHO and UNICEF and Rotary. And during that time, I think that really sparked my curiosity about what kind of public health workforce do we actually need, and what skills do those people in the workforce need to develop. And ever since then, even though my work is very kind of in the field, I've always kept an interest in that, and I took it to a PhD. So I'm halfway through my doctorate at the moment at National Taiwan University, and I'm looking at essentially workforce enumeration, how we build workforces, and what skills do we need within that. And this ties directly to my work with Public Health U, and particularly SDG 4 in quality education. So this is the team at Public Health U specifically. We've got a few more entities under the umbrella. We're across the US, Europe, the Caribbean. I obviously have an Australian accent, so I represent Australia, but based in Taiwan currently. So essentially, the Frank Foundation is a not-for-profit that runs out of the US, but within that foundation, we have a number of different arms and institutes. I work primarily with Public Health U, so we're offering free or very low cost Masters of Public Health, PhD, and Masters of Health Education programs to folks in lower to middle income countries. But there's also a strong component which includes our humanitarian response training, some steps. So these are STEM K-12 training that is also available. A lot of addiction and kind of mental health accredited work through ATHP. And then most recently, we just acquired Global Health e-learning center, which used to be a USAID funded repository of essentially public health education and online courses. But obviously USAID is no longer a funded entity. So we, much like our ethos, we didn't want to lose these kind of high access content and online access. So basically we brought that under the umbrella, and it's now again free for everyone to use and utilize. Bear with. So I pulled some of the recent data from the SDG Global Report 2025, and it was helpful to kind of get a sense of, well, how are we doing within SDGs more broadly? How are we doing within education? And what might something like Public Health U offering low-cost public health degrees mean for a solution moving forward? So I'll jump straight to SDG 4. I think the fact is that we're really not training the next generation of public health professionals. And I don't think we think widely enough about what a public health professional is. So the first kind of data point that I thought was interesting is adult participation in education and training programs has been stagnant since 2000. Obviously, everyone that's here on this panel, but also participants who are currently students, are taking an active interest in education and training. But the fact is, it's not accessible to everyone, and often internet access, often poverty means that there are distinct barriers for people to get the degrees that they need to participate in the workforce the way they are most adept to. So the call essentially that we don't have enough healthcare workers needs to be filled in a certain way. And if I speak to our current climate, I guess a little bit, as we defund public health and as we, remove funding from bodies like USAID and WHO, we're shrinking the pot that is available to provide competency-based education to train that next generation. So we have to find ways to do this a little bit more innovatively, but also to think through ways that online education can be delivered in different formats. So one of the things that we're doing at Public Health U, not only allowing no tuition MPHs and PhD, depending on your low income status and the country that you're based in. We're also offering site agnostic online delivery. So if a university in Kenya, for example, wanted to develop a new program for their MPH, but they simply don't have the resources to do that, they can bring over a bunch of our materials and resources to kickstart their MPH program in a way that they probably couldn't have done without it. Also, about site agnostic online delivery is also helpful is that there's multiple ways that they can engage with our courses. So for example, in our humanitarian sector, there's a lot of non-live downloadable content that can be essentially localized first through a process of translation and and localization, but then that is no longer needing to be completely live to get that training done. And it can be done on your phone through PDFs if that's the only way that you can do that in a war setting. So there's lots of arms to what we do, not just broader public health. There's obviously emergency medicine, environmental health, and nursing. And it really kind of speaks to, I guess, that broader One Health goal that Tomislav was talking about, in the sense that this is, particularly things like antimicrobial resistance, it takes a lot of people working across sectors, including animal health, including environmental health. We do a lot of leveraging of AI, particularly because this allows us to use less resources to get the material to people that are in need, but also ways to keep a kind of quality control. So obviously there's ways to use AI in our curriculum development, not as a content driver, but as a way to save the time of a subject matter expert by building something that is evidence-based using AI and then tested with actual subject matter experts to create the process flow that we're looking to do. The other point that I guess I bring up a lot in this kind of decentralized model is the brain drain. I remember being in Pakistan and having a lot of, I guess, tension around the fact that people had to leave the good work that they were doing in public health to get educated elsewhere, to then eventually come back to support the communities that they're looking for. I'm not interested in building a world or an institute where, you know, nurses who are doing great jobs on the front line then have to leave where they are, move across countries, or go do a residential program somewhere in order to continue or progress. It needs to be accessible to where they actually are. So I think here it's a generally warm crowd when it comes to online education. It's a warm crowd also because people are willing to jump on online webinars. But a lot of the research that we're doing as we build our programs speak to the fact that online health training doesn't have to affect quality. And there's a lot of good research coming out about the fact that blended, self-directed online courses, particularly in a healthcare setting and public health setting, actually meets the needs and has similar outcomes as face-to-face. So again, you can email me if you're curious about any of our programs, including humanitarian work. But broadly, I'm just really excited to talk about the fact that education should be free and accessible to all, particularly in public health, when we have a really big challenge ahead to essentially rebuild a lot of the public health workforces that are just going to be really low resource, and we'll have to bootstrap our way through. So I'll leave it there because it's 9:59. Thanks very much, everyone.
Thank you, Mr. Gareth Durant. That was an excellent intro, and you told a lot about the things that you said. And before now moving on to our next speaker, I would like to take the moment to thank Professor Sherman Roberts for his session. He'll not be able to join with the panel discussion, but he said a lot of good things, a lot of knowledge was shared, and I wholeheartedly thank him for his participation, and I wish him very best of luck for his travels and for all his future things. So thank you, Mr. Professor Sherman. It was a pleasure to see you, and we hope to see you again soon. Thank you for your participation, sir.
It was indeed a pleasure for me, and I want to remind everybody, if you have comments on my presentation or Blackwell University, please do get in touch with me. You can get my email very easily. Thank you very kindly.
Thank you, sir. Thank you for your time. And now let us move on to our next speaker. And she is Miss Bosun Lili Liu. She is representing UNESCO ISLAC, and she is representing SDG 3. So please, Miss Bosun Lili Liu, over to you, please.
Thank you so much, Mohammad, and thank you so much to the fellow panelists. It has been very inspiring listening to all of your interventions and really understanding, in a way, from academia perspective, the interconnection of SDG 3, SDG 4, and SDG 17 17. And welcome again to all the participants who are here today. I'm really showing the interest you have in contributing to the 2030 agenda and also to the various SDGs with the understanding that no SDG actually stands alone by itself, and everything are interconnected, grounded with the mentality of collaboration, cooperation, and partnership. With that said, I think a lot of our panelists earlier have mentioned very concretely, on the let's say the grounded pictures on how to realize, the certain goals and how higher education can actually contribute to the efforts of SDG 3 on health, SDG 4 on education overall, and SDG 17. So maybe I will provide, in a way, with a slightly different approach and talking from the UN perspective on how we have been promoting, let's say the top-down approach. Maybe before I start with really concrete terms, going into the SDGs, I should introduce myself and UNESCO ISAC as well. So my name is Boston Li Liu. I'm the head of partnerships and agenda setting unit based at the director's office at UNESCO International Institute for Higher Education. We were established almost 27 years ago, based in Venezuela, but with a global mandate that was officialized in 2021. So, I mean, if we look at the big UN picture, we have the UN headquarters in New York with, let's say, more than 30 UN agencies where their headquarters are based in different places. Where for UNESCO, our headquarters based in Paris, and then under UNESCO headquarters in Paris, we have more than 100 field offices regionally, nationally, basically everywhere. And then in parallel, we have 8 specialized institutes that's to address high demand topics of the UN, and all the 8 specialized institutes, let's say, as much as we're legislatively part of UNESCO, our mission is to serve the whole United Nations, all the agencies and all the member states that we have. And we are the UNESCO International Institute for Higher Education, which is the only UN entity with a mandate on higher education. So it has been our great honor to work with different higher education institutions and wider higher education stakeholders, including not just those within the university, so not just professors, researchers, staff, managers, students, but also those that are interconnected to universities in this higher education ecosystem, including the private sector, the public sector, the civil society organizations, and also other international organizations. So let's say the reason why I want to start with this big picture of this ecosystem is to precisely touch upon the top-down approach that we hope to take and have been taking with quite some success in bringing, different higher education efforts together in contributing to the various SDGs. I'll just give one example today because I know we're a little bit behind time. So back in December 2023, UNESCO ISAC, in collaboration with the United Nations Office for South-South Cooperation, have co-created the South-South University Cooperation Network. And this is really, let's say, with the demand that had been proposed by the wider higher education stakeholders during the 3rd World Higher Education Conference that was hosted in 2022. I mean, as much as it sounds like it's only the 3rd higher education conference, it's actually a conference that's hosted every 10 years. So it's a really big deal because it creates this directional milestones that lead people's efforts looking into the next 10 years. And during the 2022 World Higher Education Conference, it has been proposed by the stakeholders and the member states that we need to strengthen multilateralism, open science, and firm commitment to sustainability, including on health, including on education, including on partnership. And there is this element missing on encouraging South-South and triangular cooperation as a strong component within this international cooperation picture. So within this framework of this network that let's say in the preparation phase when we're creating it, we have identified 8 specific objectives that can support with eventually translating to concrete initiatives and actions to specific SDGs, all including all 17 of them. And the 8 objectives include capacity building, collaborative research, resource sharing, funding opportunities, policy advocacy, technology and innovation transfer, networking and partnerships, and then empowering Global South universities, especially those that would need a chance to have the wider platform to work with others. And moving along, the process, at this current point, we are in the process of validating the action plan to 2026 to 2030 through thematic working groups. And those thematic working groups have been, let's say, operated through 3 different rounds already, with the first round of different, stakeholders all getting together and discuss along the main 4 functions of higher education, including teaching and learning, research, community and industry engagement, and management and administration, and really to brainstorm within this interdisciplinary specialties that different representing stakeholders have on understanding the gaps, the opportunities, and what are some of the proposed concrete actions in order to move forward, and synergize out of what they have proposed. We move to, let's say, the round 2, which are co-design process of specific activities that can be led by leader universities and co-implemented by collaborating university with the support from the wider partners within the ecosystem, as well as the SUC and Secretariat, which are 2 UN agencies. And let's say one of the examples is in capacity building, which if we talk about, let's say, sustainability in action, we hope to have collectively provided by the universities to the university a community engaged learning course. And in this community engaged learning course, all the 17 SDGs have been listed. So let's say if we take the example of SDG 3 on health, how the course will basically be informing the different stakeholders on the strategies to channel community-based health system to let's say the wider health system with the expertise that's required, that's needed to be provided by higher education curriculums, and collectively co-design the curriculum in order to draw these bridges connecting knowledge to actual community practices to this professional operation at hospitals. So let's say as much as the content of the course is grounded in health, the mentality is really to mobilize the strengths of SDG 4 in education and tapping on the strategies of SDG 17 in partnership in order to collectively reach a goal that we see not only the effectiveness of connecting the dots of different SDGs, but really bringing in the different stakeholders through this collaborative co-design method to improve the real, efficiency and function, and in a way, the quality of higher education, to ensure that students do not just study, but they eventually get channeled to, the industry and to the community with the relevant impact that they have in their hand to bring to the world. So anyway, that's just one example of in total the 16 activities that we have, and I'm not gonna, let's say, go through all the activities one by one, but just let's say to bring the element of partnership, we want to stress that this United Nations South-South University Cooperation Network, in addressing all the SDGs, follows the value of, first of all, multi-stakeholder collaboration. Second, intergenerational cooperation, because we always want to make sure that youth and students are not just considered as beneficiary, not in the field of health, not in the field of education, not in the field of partnership, because they are an equal partner to join this conversation and be able to contribute their share of of inspirations, insights, and actions as well. And then at the same time, want to make sure that we have this emphasis on public-private partnership and make sure that we do not have all the burdens on the public sector for them to act. And we also bring in the strengths of the private sector so that we can also close the gap of real life practices with policy space and with the wider academia. So in a way, the academia is not really stuck in the middle either, with one pressure of serving the national development plan, and on the other hand, serving the industry, channeling in a way, the in some cases the miscommunication, and in some cases the lack of communication. And with that said, every single member who's within the United Nations South-South University Cooperation Network has been assigned with an active role to participate actively. So let's say the working group that I just mentioned was also one of the several piloting activities that we have been arranging. We have also been offering boot camps that focuses on unleashing the power of science, technology, and innovation in its contribution to create solid solutions, combating the challenges of different SDGs and really bringing the impact. So far, we have roughly 70 members from almost 30 countries, and we're still actively in the process of onboarding new universities and new partners as well to join this collective efforts and to bring the value of South-South and triangular cooperation to complement with a lot of the effort in the past in the North-South cooperation. So I will conclude with, should you have any questions, or if you're interested to know more about this network, please feel free to email me, and the relevant project officers from my team will follow up to go through the onboarding process with you. And also before that, I mean, you can take it for granted that we'll be providing more information on what does it entail in participating in the United Nations South-South University Cooperation Network. Thank you so much. I'm very honored to be here today with all of you, and looking forward to the Circle of Life.
Thank you, Ms. Boson. We started with Blackwell University, and we would like to complete the circle of introduction with another panelist, a great panelist, Mr. Professor Robert Aphang. He is the Director of Student Affairs. And sir, it's a pleasure to welcome you to this panel. And over to you for your intro, please.
Good evening, everyone. Good morning from Lima, Peru. Good evening to those that join us in Asia. A heartfelt thanks to Mr. Mohammad, Umaid, and the entire Al-Fateh Institute team for this warm invitation. It's a privilege for me to join this distinguished panel. I also want to extend my recognition to all the panelists guiding us through SDG 3, SDG 4, and SDG 17. I look forward to building upon the ideas you have shared. I would like to share my screen with a short presentation I have. I don't know if it's going to work. Let's hope it does. Can you see it?
Yes, it's coming. Yes, we can.
Perfect. So allow me to introduce myself. I'm Robert Aphang, Director of Student Services at Blackwell Global University. And I also serve as a professor in both undergraduate and graduate programs across Latin America. Additionally, I bring my experience as a consultant in digital transformation and institutional strategy, and as a former president board of SOS Children Villages in Peru and operations manager in the Shell Oil Company. Over the years, I've worked with public institutions, NGOs, and the private sector in different countries and contexts. Across all these roles, one element has remained at the center. There's partnerships. True partnerships based on shared goals and mutual respect have the power to transform lives. So that's the first message I want to send. I will also want to send a salutation to my home city, which is Tacna in Peru. So this is a funny story. When I was doing my master's in the US, and when people ask me where I came from, I would say I came from Peru. And they will ask me, so where in Asia is Peru. Eh, and actually, no, hey, come on. Peru is in Latin America. There's the world map there. And my home city is Tacna, which happened to be our anniversary today. We celebrate 96 years of the return of Tacna to the loving arms of Peru after being in control of our neighbor country, Chile, for almost 50 years. So warm greetings also to my hometown, Tacna. All right, so I was mentioning to you this important concept of the SDG 17 Partnership for Goals, because is often seen as the supporting SDG, or the one that connects all the dots. But I believe it's much more than that. It's the infrastructure of hope behind every sustainable solution. Without effective partnerships, we cannot improve health systems, we cannot expand educational access, or address poverty, climate change, or inequality. We simply cannot do it alone. From my experience, successful collaborations hinge on three pillars: shared purpose, where strong partnerships begin with alignment, not just in objectives, but in values and vision. Whether in education, health, or community development, when partners co-create their mission, they build deeper and longer lasting impact. Inclusion also is important because a sustainable partnership cannot be top down. It must include local voices, youth, and marginalized communities. And that from the very beginning. This inclusion is not just ethical, it's strategic. It strengthens legitimacy and creativity. The third pillar is the accountability. It is not enough to sign agreements. Partnerships must be based on clear roles, shared metrics, and transparent communications. The most impactful partnerships I've seen are those where the progress is measured collectively and decisions are made collaboratively. I would like to share some practical experience I had during my career, and that reflect the power of collaborations and partnerships in different sectors, in the academia, civil society, and private enterprise. The first is in Blackwell Global University. We have an active participation in the Global Academic Network in GAN, which exemplifies the spirit of SDG 17. GAN is a collaborative platform uniting universities across 8 countries and serving over 75,000 students and 50,000 graduates globally. Through GAN, we are able to promote academic mobility and cross-institutional learning. We can develop joint degrees and research projects. We can share resources for accreditation and innovation. These partnerships enrich our students and faculty experience and foster a truly borderless model of education where institutions evolve collectively. The second experience I want to share is during my time as president of the board of SOS Children Villages in Peru, where I led a decade-long effort to expand the care services for children at risk. We forged strategic alliances with private sector partners, government agencies, and local communities. Through these collaborations, we were able to build new family care centers in underserved regions, launch advocacy initiatives for child protection, and most notably, increase the local fundraising from 5% to over 50% of our annual budget in one pursuit of a long-term sustainability. These outcomes were only possible through trust-based, mission-aligned partnerships with shared responsibility and mission. And third experience in the corporate sphere, as operation manager for Shell in the French Antilles, I was responsible for logistics, distribution, and health, safety, and environmental performance. We operated in remote and geographically complex areas where safety and sustainability were constant challenges. To overcome these challenges, we partnered with local authorities to design contingency and emergency response plans. We collaborated with transporters to elevate safety standards and optimize routing, and also engage local NGOs and community leaders to deliver HSC training and promote environmental awareness. These multi-actor alliances allow us to implement a robust HSC management system that pass international audits and strengthen both operational resilience and community relations. In all three cases, academic, social, and corporate, the common thread was collaboration, built on transparency and shared outcomes and a clear understanding that sustainable development is not achieved in isolation. Higher education has a very important role on advancing SDG 17. We are more than academic institutions. We are incubators of change, platforms for dialogue, and we bridge across sectors. Through research partnerships, student-led initiatives, joint degree programs, and regional alliances, we can co-create solutions to local and global challenges. Importantly, universities can be a space where students are not just trained, but empowered to design and lead real-world interventions aligned with the SDGs. In my classroom, I often remind students the world needs more than your degrees. It needs your voice, your curiosity, and your commitment to collaboration. There are a few challenges we must face. Partnership is not easy, let's be honest. There are power imbalances, particularly between institutions from different regions or income levels, often hindering collaboration. The short-termism also reduces sustainability. Many partnerships end when the funding ends. And also the data silos, when we have lack of shared platforms for tracking progress, limits collective learnings. To address these challenges, we need partnerships that are decentralized, so knowledge flows in all directions. We need partnerships to be digital, to scale access and transparency. And we need also a human center at the heart of the process. So with that said, I thank you very much, saying that if we want a world that is healthier, more educated, and more equitable, we must partner differently. We must stop seeing collaboration as a checkbox or a logo exchange and start treating this as a living process that demands humility, consistency, and vision. So let us move from partnerships of convenience to partnerships of consequence. Okay, as we continue to dialogue tonight, I'm very grateful not only for the opportunity to speak, but also to learn from each of you. Thank you very much.
Thank you, Dr. Robert. That was a great introduction. It is great learning for us as well. And that is the end of our first session. And we will be now moving on to our second session, for which you are all waiting impatiently. So let me introduce the next session. The AFIHS Global SDG panel discussions bring together an exceptional group of global thought leaders to explore some of the most critical challenges and opportunities of our time. This event is a flagship dialogue hosted by Al-Fateh Institute of Health Sciences, a globally recognized hub for innovation and collaboration in health sciences and education. Our focus this year is on Sustainable Development Goals 3, 4, and 17, addressing good health and well-being, quality education, and the power of partnerships to achieve collective impact. In this dynamic conversation, experts from academia, public health, international organizations, and digital learning will share their insights on how these SDGs have evolved over time, where they stand today, and what the future holds. Guided by, we will journey through the circle of life framework, past, present, and future, to uncover lessons learned, explore current realities, and chart visionary paths forward. So there's a video that we will just see. It's a short video, and then we will proceed with this session.
I bet you didn't know that 3 simple goals could shape our entire future. Education, working together, they're how the circle of life keeps moving. Today, we're spotlighting SDG 3, good health and well-being, because a healthy world is where possibilities begin. Next, SDG 4, quality education, unlocking every mind everywhere so knowledge can flow through generations. And SDG 17, partnerships for the goals, because the biggest changes start when we join forces. Each of us is part of this circle. When we stay healthy, learn new things, and collaborate, we're building a future that's brighter for everyone. The session will begin immediately after this video.
Thank you. I hope you enjoyed the video. Now, let me first tell you the rules for the panel discussion. The panel discussion is called Circle of Life. There will be 3 thematic rounds, each focusing, first will be on the past, the second on the present, and the last will be on future of SDG 3, 4, and 17. So each round will be of 15 minutes. There will be questions asked from the panelists, and they'll have 2 minutes to answer the question. So you are all requested to kindly keep within the time and just answer the question. So without any further ado, we will just start it. And as we know that Dr. Robert has left, so we'll be having the 5 participants who will be answering the questions. I hope all of you can see the screen. So the first round is the past, lessons learned. So Mr. Professor Sherman Roberts, he already included a lot of things in his keynote as well. So we will skip his questions and we will move forward. So our first question in the round 1 is from Dr. Tomislav Meštrović. He is representing HIFA Global Coordinator. And for SDG 3, the question is, from your experience with HIFA and global health networks, what key lessons from past health information and communication gaps have shaped today's public health strategies?
Yes, thank you for this relevant question. I think we had a lot of examples, even in recent past. And I think maybe the clearest and painful lessons that we learned is that failure in communication can lead directly to the failure in response. And I during my work with HIFA and also broader global health networks, I've really seen how the absence of timely information and reliable information, context-appropriate information, can undermine efforts to protect population, especially when we talk about vulnerable and marginalized populations. And we have really vivid examples from COVID pandemic, where infodemic and misinformation was really rampant, and there was a lot of confusion and stigma in many cases. But also even before, in recently, we had some Ebola outbreaks, where there was often local communities who mistrusted health messages because they were delivered in unfamiliar languages, maybe, or from the institutions they were seeing as distant. So these are some lessons that we learned, and today I think health communication, we are no longer viewing it as a soft skill or afterthought. I think it's embedded in pandemic preparedness efforts, and we recognize that there is a two-way communication, and listening is as important as informing, and we will need to rely more and more on local health actors, especially community health workers and teachers and religious leaders to convey these messages. I think these are some of the most salient learnings from the past.
Thank you for your answer. Our next question is with Ms. Jennifer Johnson, SDG 17, Director of International Relations, Columbia Southern University. Looking back at your work in building international academic ties, which partnership stands out as the most impactful and why? Your 2-minute start now, please.
Thank you. So one of the things that we've learned in the past with regards to academic information or internationally is that there are no short-term fixes. Long-term empowerment is the key. We have to have some of those challenges. We have to look at some of those challenges, and we have to meet the students where they are. One of our greatest partnerships that stands out is our partnership with Vietnam. We have multiple schools there that we work with where the students take courses there locally in Vietnam, and we have our tutors, which are our professors, that travel there and share discussions and share information. And it's impactful because that program has grown exponentially in over 20 years of our 30-year existence as a university. The other thing I wanted to answer with this piece is we think about COVAX, right? It was already mentioned. We think about natural disasters. We think about all those things, those issues across the globe where the training, the education, the experience in public health and nursing and medicine weren't there. There are many, many organizations that go in and they help, but one of the things that we need to do is help empower all of the world nations to be able to sustain those natural disasters and global issues.
Thank you. Thank you for your answer, Ms. Jennifer. Now over to Mr. Gareth Durant, SDG 4, International Public Health Practitioner, Next Gen U. Your question is, combining your public health and educational initiatives, what historic approach to community education has proven most effective for improving health outcomes? Mr.
Thanks for the question. I think, first of all, we need to acknowledge that finding a through line between training someone or doing a community education initiative and then being able to track the data of actual health outcomes, it gets pretty messy, and it's hard to really say what is the definitive best practice or best way to do it. But I think the important insight that I'd like to share for this is, for too long, we spent a lot of time flying people around the world to do capacity building, organizational development for community workers and people who are already on the front lines working in public health. And in fact, I think if you take a kind of strength-based approach, or you think about it from a positive deviance approach, there are already, I guarantee you, there are already people doing really effective training and improving health outcomes wherever they are. And it's about getting the resources to them so they can continue to do their jobs, rather than assuming that there's some international expert that can send people over and kind of make the magic bullet happen. So I think it's about trusting communities know the health outcomes and responses that they need, and it's about supporting them in education and training that they actually can use on the ground to do what they're already doing well. Thanks.
Thank you, Mr. Garrett. Our next question is from Ms. Boson Lililiu. From UNESCO's perspective, how have multilateral organizations historically addressed health and education gaps in developing countries? Kindly, your 2-minute start, please. Person, are you online? Okay, we'll move forward to Professor Robert Aphang. We'll move forward to him. Sir, your question is based on your experience managing student services. Which early models of student support or collaboration helped shape today's academic networks?
Thank you for your question. Well, from my experience working across higher education institutions and student engagement spaces, I've seen that the most impactful support systems are often the simplest, those built on human connection and trust. One foundational model that continues to influence how we design support today is peer mentoring. When students support one another, whether academically, socially, or emotionally, it creates a stronger sense of belonging and community. I also seen how early career service models, particularly those that actively connect students with alumni networks and professional pathways, have evolved into broader international alliances. These small-scale models of collaboration, student to student or student to mentor, have helped shape the international institutional networks we now see flourishing, such as the global academic network we are now part of. In short, it's not always the scale of the system, but the strength of the relationships it fosters that makes lasting collaboration possible. So while the technology has changed dramatically, the foundations remains the same. People helping people across disciplines, borders, and generations.
Thank you for your answer. That is the end of the round 1. And now we will move forward with the round 2. That is the present, current challenges and opportunities. So now, as I see, we have got like 4 panelists. 2 panelists had to leave due to their time commitments. So now you can take 3 minutes each to answer the question. And so the time is on your side now. So now let us move with our first panelist, Dr. Tomislav Meštrović, SDG 3. And the question is, what current health communication strategies or innovations do you see making the most difference in public health literacy? Please.
Yes, thank you for the question. I think the answer begs itself. We are all aware of AI and natural language processing. We now have a lot of tools from AI chatbots that can answer vaccine questions, that can maybe even in multilingual fashion create health content for diverse populations. And in HIFA, we also have had discussions in the forums that it may be a good thing because it may be less prone to misinformation. Of course, we know how AI can hallucinate, and every question has to be double-checked. But overall, it may be a filter for many personalities who have maybe some different agenda when answering certain health questions. But alongside AI, I would also say that we are also seeing the revival of community-based communication models. I think messages are today more emotionally resonant. We are trying to get them delivered by people that we trust. And this is why, especially local health workers, but I would also say peer educators and youth-led initiatives, why they are so important, why they are recognized today, especially when we talk about rural areas or some underserved areas. And I think combining this technology with, in a way, authenticity of local engagement, I think this is something that we are evidencing today and will be even more important in the future. Thank you.
Thank you, Dr. Tomislav. Now for our next question, it's with Ms. Jennifer Johnson. The question is, in your international relations role, how are academic partnerships adapting to today's geopolitical and technological shifts?
Thank you for that question. For us at Columbia Southern University, academic partnerships are imperative. One of our core values is relationships. Another is building long-term relations across the board with industry, students, our alumni for all of our students, and then universities. So it's important for us as we look at the geopolitical climate and we look at things like the GDP. The GDP calls for about a 17% growth across the board. That is not an easy target for many, many nations to meet or exceed. So as we look at those things and we look at some of the challenges with microeconomic stability, we look at other challenges with policy and coherence. Many nations, their departments or ministries of education do not recognize things like, or opportunities like online learning. You think now about certain policies, especially in the United States, with regards to visas. In the political climate that we're in currently, the withholding, withdrawing, and things of that nature have been a significant challenge, and the adaptation is imperative. And that is the technological shift. The shift must be, as some have said so far, some of our panelists have said so far, the shift has to be student, educator, faculty, specialized individuals in public health across the board. It must be, if we're going to move forward as a global connection with regards to capacity building. And the other piece of the technological shift is partners helping partners. And that includes, cooperation, and includes stability, and it absolutely includes coherence to policies across the globe.
Thank you, Ms. Jennifer, for your answer. And we will be moving forward now to Mr. Gareth Durant. And the question is, how can public health-focused e-learning platforms like NextGenU address skill gaps and strengthen global health capacity now?
Again, thanks for the question. I think what feels really important to emphasize now is that we are in a huge state of flux. I come from a very traditional brick and mortar education background. I went to the University of Melbourne. I'm at the University of Taiwan now. And my experience in learning public health and doing public health came from a very kind of traditional background. But the actual work that I do in the field is almost unable to find itself a place in traditional academic settings, mainly because the needs become more acute, the frequency of crises become higher. We actually need to be able to have more adaptive platforms rather than brick or mortar universities in order to respond to what we need at the moment. And so what's cool about e-learning platforms in general is that you both have, live synchronous cohorts of, nurses from Cambodia, pharmacists from Kenya, all chatting on online forums or on calls together, bringing their local knowledge and comparing situations between them. And then you also have an emergency medical officer downloading the most important update about Mpox, because that's what they're dealing with right now. And that all is far more able to be delivered when you have a very agile e-learning platform that you're starting with, and not necessarily an ivory tower that you're then working with. So I think there's a lot of flux at the moment, and e-learning platforms and I guess like online learning in general is just more responsive in the moment.
Thank you for your answer. And I would just like to update that we received a message from Ms. Boson Lili Liu. Unfortunately, due to some technical issues, she is unfortunately not able to join us right now, but she's trying to come back. And I just received a message from my technical team that almost the participants from 21 countries registered for this global SDG panel discussion from Al-Fateh Institute of Health Sciences, and we have got panelists from 6 countries that include USA, Taiwan, China, and Peru, and Croatia. So once again, thank you to all panelists and the participants. And the last question for our round 2, present, current challenges and opportunity, is from Dr. Professor Robert Aphang. And the question to you is, how do student services and institutional collaboration contribute to building resilient and supportive academic communities today?
Thanks for the question again. Well, today students face an entirely new landscape, a global uncertainty, digital overload, and growing mental health challenges. As a result, student services must go far beyond administrative functions. They must form a resilient ecosystem of care, integration, and purpose. At Blackwell Global University and in other institutions I work with, we collaborate with mental health professionals, career mentors, and academic teams to create a wraparound system that ensures that students feel seen, feel heard, and feel supported at every stage of their journey. Institutional collaboration is also key. For example, within the GAN network, we have worked across universities to address well-being in multicultural contexts, exploring how to move students from passive recipients to active co-creators of the support systems that they serve them. After all, if we want our students to lead the global change, we must first invite them to shape the systems that prepare them for it. So these efforts not only strengthens students, they strengthen also our institutions, because a resilient student is not just better prepared academically, is better prepared to engage with the world, to lead and to collaborate across boundaries. Okay, that's what I would say about that.
Thank you, Professor Robert, for your answer. So now we'll be completing the circle of life. We talked about the past, the present, and now we'll be moving towards the future, vision and innovation. And our question, the first question is with Dr. Tomislav Meštrović. The question is, what emerging technologies or approaches could most transform global health communication and preparedness in the next decade?
Yes, thank you for this important question. I think it ties nicely to my previous answer, and that AI will develop further and it will provide even more accurate information. But I also think better global networks for sharing health knowledge will be built and established. I think HIFA, or Health Information for All campaign, is a wonderful example of network to share health knowledge, but also to strive towards health literacy. But people have to have information and easy access on their own language, so it has to be multilingual. And I think this will be increasingly prevalent in the future. And also there will be more, in my opinion, something like real-life practice tools. For example, you can have games or gamification, you can have simple phone apps. People can be more ready for emergencies, what to do during the flood, what to do during outbreak, what to do during heat wave. All of this will be expectedly prevalent in the future as well. And this can be especially helpful in schools and rural communities. And I think, of course, the development of technology will also bring easier cooperation between different kinds of professionals, not just doctors and scientists, but also teachers and community organizers. And I think I'm optimistic towards the future. I think the connection will build more trust and more understanding around the globe. And I think it will empower us for better global health communication. And also, I will use this opportunity also to provide my key actionable insights, because I also have to travel and leave, unfortunately, in 5 minutes. And I think when we talk about SDG 3, maybe I didn't emphasize in my introductory lecture or during these answers, but I think primary healthcare system have to be strengthened. I think that is the future. I think investing in community health workers, investing in essential health services, linking them with the digital technologies, I think this will be the way forward for underserved areas. We touched upon a bit about telemedicine. I think this will also be a future. And I think disease services and maternal services have to be empowered. And this is the only way to reach the postulated goals by 2030 when we talk about SDG 3. So thank you so much for this opportunity. I think I had a pleasure to talk with you all and to meet so many amazing people. So thank you so much once again.
Just
look forward to stay connected.
Yes, Dr. Tomislav, it was a pleasure to meet you. It was a pleasure to listen to you. It was a great time, and I surely hope that one day we meet personally as well, and we stay in touch through these things. So I'm really very proud that you came, and it was a great experience. Have a safe journey, and we wish you the very, very best. Thank you, sir, for your time. So moving on now to our next panelist, Ms. Jennifer Johnson. The question for you is, how do you envision future academic partnerships strengthening mutual understanding and cultural exchange worldwide?
Thank you again for that question. For us, future academic partnerships is an ongoing effort. It's one of the areas of major focus of our international relations department, but not only that, our academic department. Throughout our history, one of the benefits, and this speaks to our future, is that we're able to connect. We're able to utilize what is expected or needed around the globe. And what we do is we create programs from the associate's level through the doctoral level, as well as those continuing education courses I mentioned earlier. And I agree that mental health across the board is a crisis. My background is in education, teaching, and learning, in concert with human services counseling and a concentration in crisis and trauma. The other future for myself is a doctoral in crisis and traumatology. And with that comes with the crisis of mental health is one example of that cultural exchange. We need to understand what the country unique priorities are. We need to know how we can help, and we need to meet our students, our learners, the corporations, universities, and other exchanges worldwide. And it speaks also to some of our panelists that have said, you know, meet the students where they are, meet the individuals where they are, focusing on systemic issues across the globe and making sure that the progress is possible across the entire globe. One of the other pieces that we would consider is a future ready mindset. We utilize what is available today. We look into the future, what might be available, such as AI, right, as it's developing and growing, and other programs or opportunities. When we have a future mindset, we are able to educate across the borders. We are able to work together in a multicultural way, learning from one another in the classroom and outside in those exchanges.
Thank you, Miss Jennifer, for your answer. It was very valuable information shared. And now we'll move on to Mr. Gareth Durant. Your question is, how might community-based education and technology-driven learning combine to improve public health outcomes in the future?
I think the takeaway for this question is, first of all, I'm not a futurist and I'm worried about making predictions. Two, we can't put all our eggs in one basket. So even if there is really great gains to be had with technology-driven learning and AI, we also have a really unlevel playing field where that happens. We have governments that can shut off internet for groups of people who they don't want to have access to things. We have poverty and other issues which stop people from getting involved in that. And at the same time, we have to invest in our public health infrastructure, regardless of what's happening in education and regardless of what's happening in tech. And we also have to really think through, do we have enough people with the skills and experiences they need, i.e. the education side of things, in order to then help direct tech where it needs to go, as well as where the public health group needs to go. There is a beautiful nexus in the middle where it all works together. I can say directly that I used to work on health and human rights issues, and it would take months to translate documents about human rights violations in Myanmar or some other country. And then that process has been speeded up so hugely, and now we can really start to respond as we need to, almost in real time, when we have reports that come in about health and human rights issues in certain countries, because of the fast translations that we can do, or even community-led fast translations that are AI enabled. So there's a beautiful nexus of where it goes right, but there's also a lot of uncertainty about where it could possibly go wrong. And we actually need to kind of fight this on all sectors, and not necessarily leave one to just develop without an analysis of how it's helping health, how it's helping education, and how it can be ethically applied.
Thank you, Mr. Gareth, for your kind words. And now we will, just as we completed the circle of introduction with Professor Robert, we'll be completing the circle of life and circle of this panel discussion with Professor Robert. And your question is, how could student service evolve to foster deeper engagement and global collaboration among learners in the future?
Well, thank you for the question again. I'm also not a futurist, but I like to gamble. I would bet that the future of student services lies in personalization, global connectivity, and also co-creation. In the years ahead, I think we will see student services evolve into global platforms where learners from any part of the world can access mentorships, career support services, mental health guidance, and leadership opportunities in real time across borders. Technologies like artificial intelligence, smart data, and micro-credential systems will allow us to personalize pathways for students, not only based on academic interests, but also based on their personal goals and social impact aspirations. But beyond tools, we must also rethink on the structure. Students should not just receive services. They should help design them. At Blackwell, for instance, we have pilot student-led feedback councils that guide how services are delivered across cultures and languages. Ultimately, if we want learners to collaborate globally, we must first model collaboration through the very services we offer. We're breaking down silos and empowering students to be the co-architects of the academic experience. Thank you.
Thank you, Professor Robert, for your words. And that is the end of the panel discussion. And now we will formally conclude this session. As we wrap this engaging discussion, several key points emerge from our 3 rounds. We heard how education leaders like Professor Sherman Roberts stressed the importance of global standards and technology in expanding access, while Dr. Tomislav Meštrović highlighted that clear, timely health information is as critical as medical care itself. Ms. Jennifer Johnson and Professor Robert Aphang reminded us that strong partnerships and student support systems are the backbone of progress, and Mr. Gareth Durant and Ms. Boson Lily emphasized that health and education cannot thrive without community-driven approaches and international collaboration. Together, these insights paint a clear picture. To move forward, we must learn from the past, act boldly in the present, and innovate for the future. Before we close, I'd like to invite our panelists to share one key takeaway they want the audience to remember and apply. Whether it's a piece of advice, a call to action, or a single idea to reflect on, your words will help turn this conversation into a practical step. So please, I'll start with Ms. Jennifer. You have 1 minute for your message.
Thank you for the opportunity to share key takeaways. I'll merge 3 takeaways in 1 minute. The first is global sustainability. The second is investing in people. And the third is building relationships of trust across the globe. When we do these 3 things across not just public health, but medical services and such, that helps us to make sure that that capacity development and building work together to build a global and sustainable future. Thank you.
Thank you very much, Professor Robert Aphang. Your 1 minute, please.
As we bring this dialogue to a close, I want to express my deepest appreciation, not only for the opportunity to speak, but for the chance to learn alongside such committed and visionary colleagues. Well, today, Exchange has reaffirmed a powerful truth. None of us can achieve the SDGs alone. Whether in health, education, or partnerships, impact happens when we come together across disciplines, across borders, and across generations. So my final message and the takeaway is this one. Let us not only talk about sustainable development, let us embody collaboration as a daily practice, because every meaningful partnership begins with a conversation, and I believe this one will continue well beyond tonight. Thank you.
Thank you, sir, for your kind words. And now I would like to give the stage to Mr. Gareth Durant for his 1 minute, please.
I guess my takeaway from today is honestly that no one is coming to save us. We actually have to show up and work towards these really lofty, often seemingly unattainable goals. but ultimately that's the gig, right? It's about showing up and working together and being clear about what's needed in our local vicinity, as well as collaborating across those borders. So by coming to a webinar like this, you're already showing up in a way that is really commendable for the world that we want to live in. And I've really enjoyed my time today here. Thanks, everyone.
And that will be the end of our session. And I thank each and every panelist. I thank each and every participant. And it has been truly an honor representing Al-Fateh Institute of Health Sciences in this session. And I am very respectful and I am very thankful to all the panelists who have got tremendous experience, who have got tremendous knowledge that they have shared us. And the good news is that this session is not one and off. We will be continuing, we'll be inviting these panelists, we'll be encouraging them to bring in more panelists as well, so this global coordination can continue. And for all the SDGs, I'll just end with one quotation. And before that, I would like to apologize because we have exceeded time, but there were so many top-notch panelists that it has to happen a little bit of overtime. So I will end with one quote, and that is that winner never quit and quitters never win. So we will never quit. We will keep on fighting for the SDGs, for the sustainability, and we will make this world a better place, not only for ourselves, but for the generations to come as well. So thank you all. It has been a pleasure, and I salute you all. Thank you, sir. Thank you very much. We'll be closing now. Thank you all. Bye. Take care.